Hi, my name is Gobind Anand, and I'm from the University of California, San Diego, and the VA Medical Center in San Diego. It's my privilege today to discuss our study comparing the use of cold snare polypectomy to hot snare polypectomy for the resection of nonampullary sporadic duodenal adenomas. The concept for this study came about because over the last 5 to 10 years, we've seen an emergence of the use of cold snare polypectomy in the resection of colon polyps. The potential benefits of using cold snare polypectomy in colon polyps is reduced risk of complications such as bleeding and perforation. And studies have shown a similar efficacy rates between the two techniques. However, the data for optimal resection techniques for duodenal adenomas is still unclear, and there isn't very much data published about comparing hot snare versus cold snare resection for duodenal adenomas. Anecdotally, I'd noticed in my own practice and amongst the practice of my colleagues that we were starting to use cold snare polypectomy more and more for duodenal adenomas. And so the goal of this study was to compare patients who had duodenal adenomas who underwent hot snare resection versus cold snare resection and really focus on two main endpoints. One was to look at safety. Was there a similar complication rate in hot snare versus cold snare resection? And number two was to look at efficacy. Were these two techniques similar in resecting the polyps, and were the recurrence and residual adenomas rates fairly similar between the two groups? And so to perform the study, this was a retrospective study in which we examined all patients who had duodenal adenoma, which was resected with snare resection between 2007 to 2021. We identified a total of 110 patients, 69 of whom underwent hot snare resection and 41 of whom underwent cold snare resection. The baseline characteristics were fairly similar between the two groups. The median polyp size was 15 millimeters in the hot snare resection group, 12 millimeters in the cold snare resection group, which was statistically similar. And when we started to look at safety, what we found is there were a total of 7 complications amongst the 110 patients. All 7 complications occurred in the hot snare resection group. There were 6 delayed bleeds, all of which were managed endoscopically and did well. And there was 1 patient who had a perforation, which was managed surgically and also did well. None of the complications occurred in the cold snare polypectomy group, and there was a statistically significant difference in complication rate between the two groups. When it came to efficacy, we had a total of 54 patients who underwent ongoing surveillance at UC San Diego and the VA who we included for this analysis. Of the 54 patients, only 8 had residual or recurrent adenoma, and of those 8, 5 were in the cold snare polypectomy group, 3 were in the hot snare polypectomy group. All of these were managed endoscopically, and some of them are still undergoing surveillance now. And the largest residual polyp is only 6 millimeters in size. On multivariate analysis, when we compared predictors of polyp recurrence, we found polyp size to be the only statistically significant predictor. For each millimeter increase in size, there was an 11% increased risk of polyp recurrence. In that multivariate analysis, resection technique, cold snare versus hot snare, was not a statistically significant predictor of recurrence. So with that in mind, our study finds that when comparing hot snare polypectomy versus cold snare polypectomy for the resection of sporadic non-ampullary duodenal adenomas, cold snare polypectomy appears to be safer with lower complication rate, and the efficacy appears to be similar between both groups. As with any retrospective study, there is concern for selection bias, and going forward, I think this is really an interesting area of study and is really prime for a randomized controlled trial comparing these two techniques. Thank you for the opportunity to present this.